It's John Holcomb. I'm a trauma surgeon in Houston, and I'm happy to be back testifying in front of you again and answering all your questions, just like last time.
Yes, sir.
Mr. Chairman, we've talked about trauma a little bit today, and I want to really focus in on that issue for just a second. And just a little epidemiology. Trauma is the leading cause of death from age 1 to 44 in the United States. Because it's a disease of young people, it's far and away the leading cause of life years lost, outweighing cancer and heart disease by a factor of 4. So trauma injury is a really big deal. Over 100,000 deaths every year in the United States. Trauma centers, which is what we discussed earlier, that trauma funding, absolutely improve survival and are cost effective. So anything that decreases the ability of a trauma center to stay open to take care of trauma patients is not cost effective and increases death, to put it very bluntly. A third of the trauma patients don't pay because they have no insurance. So now you have a trauma center that is cost effective compared to other hospitals that saves lives and cares for a third of their patients don't have insurance. We must keep these trauma centers open. The trauma funding that we discussed earlier with the $300 or so million are sitting over here to help justify the budget, and a portion of that goes in to be dispersed every year. There's a little bit of question whether that's $75 or $84 million. If that is cut, will impede our ability to take care of the trauma patients. The number of trauma patients has gone up since the last time I sat here in front of you. It's gone up by about 4%. People still moving to Texas. Nobody's being safer in Texas. They're still getting hurt. And so our admissions actually now are greater than we talked last time when Ike hit us. So our admissions to our trauma center are higher now than when Galveston shut down and we had the discussions with Representative Island. Cutting those trauma funds from the trauma fund that you all have will absolutely cause us to not be able to hire doctors, to train residents, let nurses go, and we won't be able to take care of as many trauma patients in our region of Texas. So with cuts coming in all directions, Medicaid being cut, Medicare, all cuts in all directions, to cut those trauma funds from the state would be a really big deal from us. I would say that the funding that we received from you all and your work last year, 2 years ago, was extremely important for us. We were able to hire physicians. Dr. Andy Burgess, a really well-known orthopedic surgeon, Representative Swerton, I'm sure you know of Dr. Burgess's work, and orthopedic traumas joined us from Florida and is doing great work. I just want to emphasize as much as possible maintaining, if we can, the amount of funding we had in the last session. It would make a lot of sense to a lot of people to use more of those funds, since that's what they're supposed to be used for. We understand that's difficult this year in this session, but at least maintaining where we were is very important for survival. And it'll also be cost effective because you keep those trauma centers open that are the most cost effective place for trauma patients to go. Thank you very much.